Hypokalemia increases the heart's sensitivity to digoxin by reducing competition at the sodium-potassium ATPase pump, significantly increasing the risk of toxicity and arrhythmias. Monitoring and correcting potassium levels are critical for patient safety. Mechanism of digoxin and potassium interaction. Digoxin's action. Digoxin inhibits the sodium-potassium ATPase pump in cardiac myocytes, which reduces potassium uptake into cells. Increases intracellular sodium, indirectly raising intracellular calcium levels to enhance cardiac contractility. Role of potassium. Potassium competes with digoxin for binding to the sodium-potassium ATPase pump. When potassium levels are low, hypokalemia. Less potassium is available to compete with digoxin. Digoxin binds more strongly to the pump, amplifying its effects. This increases the risk of toxicity. Why hypokalemia increases digoxin toxicity. Increased sensitivity of the heart. Low potassium enhances the inhibitory effect of digoxin on the ATPase pump. This leads to excessive intracellular calcium accumulation, causing stronger and prolonged myocardial contraction. Increased risk of arrhythmias, as the myocardium becomes more excitable. Predisposition to cardiac arrhythmias. Hypokalemia itself increases the excitability of cardiac cells, making them more prone to premature beats. Bradyarrhythmias. Ventricular tachycardia or fibrillation. Reduced safety margin. With hypokalemia, the therapeutic to toxic ratio of digoxin narrows, increasing the risk of toxicity even at therapeutic doses. Clinical implications. Monitoring. Always monitor potassium levels in patients on digoxin, especially those with conditions like diuretic use. Loop or thiazide diuretics cause hypokalemia. Poor dietary potassium intake. Renal dysfunction. Treatment. Correct hypokalemia before initiating or continuing digoxin therapy. Use potassium supplements or adjust diuretics to maintain potassium levels in the normal range. 4 to 5 milliequivalent/L is ideal. The severity of ECG changes depends on the degree of hypokalemia. Mild hypokalemia, 3.0 to 3.5 mol/L. Slightly prolonged PR interval, indicates a delay in atrial to ventricular conduction. Shallow T waves, T-wave flattening starts to appear. Moderate hypokalemia, 2.5 to 3.0 mol/L. Slightly peaked P waves become more pronounced. ST depression, widespread ST segment depression suggests potential myocardial ischemia. Prominent U waves become more noticeable, typically in leads V2, V3. Severe hypokalemia, 2.5 mol/L. Significant prolongation of PR interval, greater delay in atrial to ventricular conduction. Marked ST depression, more severe ST depression can be seen. Deep T-wave inversion indicating significant repolarization abnormalities. Prominent U waves are very pronounced. Potential arrhythmias, risk of life-threatening arrhythmias like ventricular tachycardia and torsades de pointes.
When your potassium levels drop to 3 milliequivalents per liter or lower, you might start seeing some specific changes on your ECG. For instance, the T wave flattens out, the U wave becomes more prominent, and the amplitude and width of both the T wave and U wave become equal. You also see some other changes, like the ST segment getting depressed or flattened, or the R waves getting larger. The QRS complex gets wider, and the P wave gets taller and wider too. When your potassium levels drop even further, like to 2 milliequivalents per liter or lower, the changes in your ECG can get more pronounced. For instance, the U wave, which is normally smaller than the T wave, can start towering over it. And the QT interval, which measures how long it takes for your heart to fully relax and refill with blood after it contracts, can get prolonged, meaning your heart might take longer than usual to recover between beats. In really severe cases, when your potassium levels are less than 1 milliequivalent per liter, the U wave and T wave can actually merge together, making it hard to tell them apart. It's like if you had a bunch of kids wearing the same uniform, and you can't tell who's who anymore. I mean, the heart's trying to do its thing, but it's having a really hard time because it's all jumbled up.